The horse's anatomy is adapted for three aspects of movement. Moving very fast for short distances, sprinting away from predators over short distances, migrating long distances up to 300 kilometers at a time, or standing around for 19 hours a day. And all of those have required or initiated changes in the skeleton that make it very different from ours. Having said that, all the same components are there. Here is the shoulder blade, very similar to our shoulder blade up in here. This bone is the humerus, or upper arm bone. On us, it's found right here. It has the shoulder joint at one end, and it has the elbow joint at the other. And notice how different it is to ours. It's shorter, it's very much more stocky, more strong, more robust. But also, it's relatively short. It's actually physically shorter than our own humerus. And notice that the elbow, instead of floating free from the body, as our elbow does, is tucked right into the body. And we'll come back to why that is later on. But just note it for now. If we now move down from the elbow, we come to what should be two bones, the radius and ulna, the bones of the forearm. This is the radius, and this is all that's left of the ulna. It's a very powerful lever that the muscles can work on, but that's all it is. In us, we have a very different situation. We have two bones in parallel, the radius and ulna here, and what they allow us to do is rotate our arm. So we can stick our palm upwards, or we can place our palm downwards. The horse can't do that because it doesn't have both bones fully operative here. And that's entirely necessary because when the horse is running, its one toe sticks out. You do not want any force to be able to twist that toe in either direction, so it loses the ability to twist. We can do that, the horse very definitely can't, for good reason. Our next bones down are the bones of the wrist, or the carpus, and you can see there's a lot of them. And if you ever see x-rays of your own wrist, you can see there's lots of them in here too. Little short bones right in this region allow the wrist to move. So bones of the carpus. Moving down from the carpus, we get to the bones of the back of the hand. These are called metacarpals, and we obviously have 5 of them. In the horse, there's only 3. There's number 3, which is right down the middle, and number 4, which is this one. And on the far side, you can't see it, but there's another splint down here, number 2. So 2, 3, 4 are present, but only 3 is doing the work. It's the only weight-bearing one, because as you can see, the splints end short. Then we get to the knuckle joint, right here. This is the knuckle joint. And we see the little sesamoid bones. And humans actually do have little sesamoid bones right there. Some humans, and you can see them on x-rays, but you can't really feel them. But in the horse, they're extremely important. Below the sesamoid bones, we have the 3 bones of the finger, 1, 2, 3, just as in humans. These are called the digital bones, or phalanges. And 1 and 2 are the long and short pasterns are fairly similar to ours, but this one's very different. The coffin bone, the 3rd phalanx, is modified to accommodate the shape of the hoof.